Happy October 19th and welcome to the Dalles Chamber of Community Affairs. Today our guest is Scott McKay, who does not know how to retire. So he is continually always giving back to our community. And today he's going to talk to us about Circles of Care and Age Plus. Just another piece of his heart that has a passion for our seniors and our community. And so we are anxious to hear what they are doing, what they offer, and how they work with our community and our seniors. But before we do, we're going to go ahead and around the room and introduce ourselves and our organization. And if you have anything to add, if you keep it short and sweet, I'll let you go by with that. So we're going to start with Phil Brady.
Good morning, I'm Phil Brady. I'm Wasco County Commissioner, and I've been spending the last couple of days babysitting my grandson who was throwing up, couldn't go to daycare, so I haven't got a lot to say. Last week, there was an amazing tour across South County, but organized by Kate Willis, the South Wasco Alliance. Where we had, oh my gosh, we had about 75 people at that. More people from state agencies in one place than Salem. And so it was a great show of things happening and what can happen in Antelope, from Antelope to Simnasho, and up all the way up to Maupin, Dufur, Ty Valley.
Thank you for doing that, Phil. Thanks for being a part of that. Brian.
Brian Tech retired, but not like Scott. Scott's my hero. He's the John Wayne of retirees here. So, but my wife and I are full-time babysitters for our 7-month-old and 2.5-year-old grandsons like Phil. And I'll tell you, I'm thinking to call Scott to get some help here because it's a busy time raising two boys.
I hate to tell you this, Brian, but full-time daycare is kind of out of retirement. So you kind of are following Scott's shoes already.
I think I'm becoming crazy, but that's all good. That's a good thing for you.
All right. Thanks, Brian. Rob.
Good morning, everybody. Rob here at Mid-Columbia Senior Center, as you know. Anyway, what's going on at the center? This next week, first off, today or tomorrow is the last day you can submit your applications or nominations, I should say, for the Ageless Award for Wasco County. And Phil, since you were down in South Wasco County, I'd really love to it would be cool to get someone from Antelope up here to, honor them for what they do in their community. I'm not sure if anyone's down there who does or not, but if you know of anyone and any of you, Scott bought me Scott, Maupin or Ty Valley lady or person yesterday, right?
I think from Womack.
Womack, okay, very similar. So yeah, so we could get more nominees so that we can choose 4 good candidates to award. That banquet will be on November 17th, which is a Friday right before our bazaar. And the other thing that's happening is next week on Friday night, October 27th, we are having a sock hop here at the Senior Center, and it's all coming together. Bargeway is going to be here to serve a little bit of beer and wine, and bring your cash because it won't be cheap, as beer and wine isn't anymore. He told me how much he was going to charge for a glass of beer, and I went, oh, well, it's a good thing I'm not an alcoholic. I'd be broke. So anyway, Randy Haynes will be doing the DJ work for us, and Randy's kind of on his way out of the business, so it might be one of his last big gigs, and we're kind of excited that he's willing to do that. This sock hop will be to benefit Relay for Life as well as the Mid-Columbia Senior Center. So it's $5 at the door to get in. That goes to Relay for Life. And once we get you in here and ply your mind with a little alcohol, we're going to get some more money out of you for the Mid-Columbia Senior Center. So, but at any rate, we're going to have a blast. So make sure you make it through and if you haven't been to the center for a while, Phil, you got to come in. Tanya, you got to come in. Brian, bring your 2-year-old. It'll be fine. Thanks, guys.
Bingo. Bring your 2-year-old and markers and bingo cards. There you go.
Yep.
All right. Thanks, Rob. Tanya.
Tanya with Northwest Natural. Not a lot going on. Kind of interesting, though. Phil might find this interesting, maybe. I don't know. But one of the committees that I'm volunteering for is to help with the rodeo arena out at the county fairgrounds. They need a lot of attention. And so we had a meeting on Sunday that was kind of interesting and out of my norm, and seeing what we can do safety wise to just improve those grounds and improve how things are set up. So more to see as we move forward with this new endeavor. So stay tuned.
Yeah,
Tanya?
let's talk, because there's, let's talk. Okay.
That's what this is all for. We love the connectivity. So, um, before I pass on to Scott, just a couple things. We just finished up with the Oregon State Chamber, joint efforts with Washington State Chamber. Many things on the docket as far as just relevant issues of, as you know, all the hot topics, but they're just looking at some other things that are coming in the line for short session. So I will be keeping you guys up to date as that is happening. Not all good. Some of them we're trying. We did get a little optimistic report on what Providence Health is doing as far as health insurance coverage. That's through the Bend Chamber, and that's actually who we go through. It is actually, they're adding benefits for no extra cost. It's a little switch. So it was kind of a little positive moment. It was like, oh my gosh, healthcare is getting better. For the moment, we'll see what happens in 6 months, but there's some other forecast of things are coming. So we'll do a summary in the next couple weeks. I am going to shared just with a couple earlier. The nonprofit training session is this morning up at the college. It starts at 9. I still have room if anybody wants to come in and last minute show up. You are welcome to. It is free. This is being sponsored by Google, and Allison Hart, who has been in this industry for a long time with nonprofits, will be the one who is doing the training. And right now we have 72 registered. I'm just thrilled with the numbers. And so that is happening. And then there are several things that are going to be happening next week. So be watching both your email and your physical mail. We'll be sending out all kinds of information with the parades coming up, nominations for our banquet, along with opportunities for all lined out for next year, so that you guys can look and say, oh, these are all the events. This is what it means to be a sponsor. I can plan for the whole year ahead. So that will be coming out in the next couple of weeks to our members. And then on a tourism site, I'm just going to give you a quick update because I haven't. We do have a rare program staff person in our office that we're sharing with the city. And she is working on different projects for the city, but our project is destination development. Anne is working on that as far as looking at analyzing, processing, see what it is, see what the trends are, what are we missing, and how can we get that here. So that is one of the things that we are working on behind the scenes with tourism. So now you have a quick update. And no, I've only had one cup of coffee, I promise. So with that, Scott, I'm going to give it over to you, and we want to hear what you're doing, what this agency does. We know that you have a passion for our seniors, and we love it that you're always with their hearts in the front. So go ahead and share with us what's going on. And if we need anything, I'll help you where I can.
Well, thank you very much, Lisa. Before I start, a couple of comments. Phil made me think of Southern Wasco County, and my wife was down there for a library meeting because she's on that advisory council, and you need to go down and see the library down in Maupin in the city hall. It's quite impressive. Yeah. And Lisa, if you ever get down, feel kind of down, just go visit Rob at the senior center, and they will really lighten you up, because the senior center is a fun place to be. And then Tanya and I are still friends, I hope, even though I was her teacher back in Petersburg back in the old days. I just hope she doesn't remember how that went. Anyway, well, thank you. I am with the community liaison for Circles of Care. And let me see if I can, this is the test. Let's see if I can. Okay. Can you see the screen?
Yes.
Okay. Okay. So everyone can see that.
Yep, it looks
Okay.
great.
So I thought I'd be impressive and put the Dallas Chamber of Community Affairs.
You are.
Boy,
Look at
how
that.
about that?
I'm going to send people to you for lessons on how to do this.
Okay, that's the highlight. So we'll see what's next. Well, one thing I wanted to talk about is, start with Age Plus. There are the They're the organization that Circles of Care works under, but Age Plus has a mission of empowering, communities of all ages of value and care for older adults, especially those who are isolated and low income and underserved. They are particularly interested in rural communities. Well, they work to forge innovative solutions to improve the lives of older adults, which I'll get to. Focus on the need that's greatest, including in rural areas, low income and in communities of color. And they always bring this aging lens to initiatives and partner organizations serving the lifespan. The Circles of Care model was first introduced in the Dalles because as a rural community that Age Plus identified, and it's been a real benefit to the community. But other initiatives besides Circles of Care is that they also look at housing, and currently they are opening up a senior housing project in Talent, Oregon, and they have a Circles of Care liaison there, and they are beginning to build the senior housing in Madras, and they also have a community liaison there connected to the housing unit, and I think that's on property of the Catholic Church, because I partner with the Catholic Church there in Madras. So housing, a big initiative. They also worked on the Shared Future initiative, and that was to create a multi-sector plan for living and aging. Cross-sector effort includes strategies for 10 or more years, includes a broad pool of stakeholders, and that means not just the agencies like often happens, but education and the business community and other stakeholders who serve and work with older adults. And the intent is to have it institutionalized by the executive and legislative branches. They tried to get a bill passed this last session, but it never made it through. So they're working with the governor to create that stakeholder group. And so they're trying to guide the restructuring of state and local policy programs. Funding is geared towards aging well and in the community. And let me back up a little bit. The Age Plus was developed by Karen Brown Wilson. And she had the Jesse F. Richardson Foundation, which she set up in memory of her mother. And Karen Brown Wilson, she's been an innovator in services and the experiences for older adults. If you think about the assisted living concept that's so common these days, she was the one who introduced that first nationally in Portland. So that's kind of one of her brainchilds. And then she's also works with community living that operates a different Rock Cove in Stevenson, and a housing project and another one in Washington that are both run by Columbia Cascade Housing. So she's been, her whole life has been dedicated to older adults. Anyway, she is one who really reminds us that there's a tremendous shift going on with the aging population, and there's going to be a greater demand for comprehensive services. Now, this is a profound opportunity for older adults, since you can consider them an untapped asset. And by creating a framework for cross-sector supports and services across a lifespan, we can follow the strengths-based approach to help all generations thrive. As I don't know if you noticed, but it seems like whenever I go to a conference or I go to a business, you see a lot more older adults working these days. And they're doing that for basically two reasons. For some, they have to, because they don't have the savings that they need to live. And some of those just do it because they want to continue contributing and continue being active in the community by working. The other thing they do, they have an annual Ageless Awards program that I think it takes place in April. And this, from this Age Plus and their Ageless Awards is where I got the idea of doing the same thing in Wasco County. I forget how long ago, Rob, 4 or 5 years ago, started the program recognizing 4 individuals in Wasco County who are 75 years or older and demonstrate the importance of living a purposeful life and continue to make significant contributions. And I was so excited about the idea because it was for individuals 75 years and older. It's just not you think of, the active older adults, maybe retired, early retired, 65, 68, but these are folks who are 75 and older who are still contributing. And 75 and older means there's some that are 80 and may even be 85 who are still or older who are contributing to the community. And Rob definitely knows that with all the volunteers that he has at the senior center, at the center.
Scott, can I interrupt?
Yep.
And Rob too. Do you see a difference in the way people in their mid-60s and people in their 75 plus, the way they contribute, the things they do, or the talents and skills to what they offer?
Well, sometimes, tell you the truth, I can't, between 65 and 75, I can't see a whole lot of difference. Sometimes when you're the younger 65 or so, they may be busier as far as vacationing, taking trips, that type of thing. But I think and Rob, he may have another way of looking at it, but I find that, between, 65 and 80 and almost 85, people are contributing quite a bit. And 80, 85 is when people start slowing down more and start, having more significant challenges with mobility and that type of thing. It's like technology. If you talk to us, we'll come to that, talking to a 65-year-old or a 70-year-old, the majority of folks at that age they understand technology. I'm not sure about Brian, but most people, they understand technology. But when you get up to the 80, 85, there you start, they're not interested, and sometimes you think rightfully so, of getting connected and all that. I don't know what you think, Rob, but
well, I when I came into this as, a novice, a year and a half ago, almost 2 years ago now, I had no idea what contributions are being made by someone even over, say, 60. I'm reaching 60 myself, and I'm seeing that the age of someone nowadays is different than it was, say, 40 years ago when I was a young man. When I got out of high school, let's put it this way. My dad passed away before he was 60. My mother did too. And so you're looking at a lifespan that's much longer than it was 40 years ago, even 10 years, 15 years. I'd say that the average lifespan is affecting this. People are just healthier, they're living longer, and it's not everyone, of course, but mostly. And I think in living longer and healthier, they're actually more active, and I think they're more on the ball, if you would. And if I've got several 65 plus year people here who volunteer, and up into the I would guess 80s, early 80s, and I've got one lady who will be serving at the desk today, and I don't know exactly because it's not gentlemanly to ask, but I'm thinking she's 82, and she's teaching a painting class. She's doing things around town for other entities, and she'll be here at the desk helping me while I'm gone to the conference at the college this morning. And she is definitely on the ball. And so that's just kind of how it is. That's the average here. That's not the exception. And so it's kind of exciting to see that, and especially as I approach these ages myself, that it's not over. Life isn't over until you just got to keep take it one step at a time. And it's really pleasurable to see that happening.
Let me close here with, I'll let Scott talk. I'm going to go into a social comment for a minute. Things we do in public health change our abilities of the whole population to have people in this 65, 70-year-old age. And I'm thinking a prime example is campaigns to reduce the amount of smoking. If there's a lot of smoking going on in a population, that kills people off in their early 60s. And then that person who's all that, their contributions that we're talking about that could have happened later on in their life had they lived and not been a smoker, come down. And so it sounds like the way it's phrased there, it was their individual choice, but smoking is a social, it's affected by, well, just by the price of a pack of cigarettes. And we see that in studies right along this, what's one of the Great Lakes, Ohio, Pennsylvania, New York, 3 different counties that are border each other, different policies on taxing smoking. And the Ohio has a average age is 5 years younger in death than 2 counties over in New York, where they have a higher tax on smoking. So there's a social aspects to keeping people longer.
Yep. Thank you, Phil. So 75, the Ageless Awards, and just remind you what Rob said, that, you know, get in your nominations by tomorrow so they can be reviewed and all. Okay, and the other initiative besides, you know, housing and the shared future and the Ageless Awards, they started a Circles of Care program initiative, I think in 2018, 2019, and started here in the Dalles. And basically is, you know, neighbors helping neighbors. It's a mutual aid volunteer program, and what we try to emphasize is we're not doing in-home care like professionals. And we do that little help to help people remain independent and engaged. And and the volunteers use their attributes. We have several that are retired nurses that really help. And then the goal is that those older adults who are receiving those periodic supports also help support someone else. That can be a challenge for many because those we are supporting are homebound and unable to get out. But we have one example is a woman who, well, I set up with a volunteer, and that volunteer was visiting, you know, basically just once a week, an hour or so. But she said Circles of Care saved her life. And she had been down when I first visited, and she was just basically in her bed, having medical issues. But with just having someone visit with her, a neighbor, made a difference in her life, where she now wants to volunteer and give back somehow. And she doesn't have a car, so she's limited, but right now she's working on crocheting some shawls that we can give away during Christmas to other older adults. So she's found a way it was her idea, and she found a way to help give back. The Circles of Care, you know, well, you find out, okay, let me just go through this. You know, ideas to have successful aging in your community, matching older adults with trained volunteers, assistance with everyday tasks. Now, and I'll have a slide about what those tasks are, and to reduce isolation and loneliness. And that is, as the Surgeon General says, an epidemic of loneliness in the country these days. And I think maybe because of technology or whatever reason, it's a real issue that needs to be addressed at the national level. And the value contributions of everyone in the circle and it complements existing volunteer efforts. So some of the types of, tasks we provide, we do grocery and prescription pickup, which is, we get several requests for that. Light chores, which we get several requests, but it seems like finding someone to do light chores when they don't want to do that at their own home is kind of hard to find. So I really haven't found anyone to do, that light yard work or that type of thing. And then rides, right now we have five people who are qualified to provide rides. So I just talked with, I don't know if you know Jody Chastain down in South Wasco County, and he provides transportation for South Wasco County. But I think I realized about 8 months ago, he provides rides for people in the Dalles, and basically is for those folks who want to go into Portland to OHSU or Providence, someplace. And so I've talked to him several times so that if he gets any requests for a ride within the Dalles or between the Dalles and Hood River, we'll cover those. Circles of Care will find a driver for those rides, but that we will refer, anytime we get a request for a drive to a doctor's appointment in Portland, we will refer those to him and see if he can provide those rides. The public transportation system is a terrific system, and my goodness, it's improved so much from the very beginning. But there's still some individuals that it's difficult for them to access, or it's just a challenge, maybe because of mobility issues. But so we try to work with the link and and also with Jody Chastain in South County. A couple of things we have not done, although we could, is caregiver respite. We basically are volunteers. The commitment is like 1 hour at a time, and preferably 1 hour a week to make a visit or provide the rides. But we had a request for someone who, her husband has Alzheimer's, and she wanted someone to watch him for about 4 hours so she could play bridge. And that was just beyond what I can expect from our volunteers. And then making a meal, we haven't had any requests for making a meal. That's generally, we have a lot of our Circles of Care members, they are receiving Meals on Wheels. And so if they have problems with meals, we always encourage them to sign up with Meals on Wheels. Zoom support, we don't have anyone who's really been interested in Zoom support, but the main thing we do is this friendly check-ins, create friendly visits. Like I mentioned with the one woman who was depressed, and those friendly visits made such a difference. We have a lot of folks who have very little contact with other folks at all, and so that friendly check-in is critically, that visitation is so important. Now, we talk about the changing in the demographics.
Can I interrupt again? I have a big idea.
What's that?
Can I interrupt again? I have a big idea.
Have a big idea?
Yeah. So imagine a senior who needs to have a letter written, and this can be a friendly letter, it could be a former letter, something, and they're just not able to either get to a typewriter or don't feel confident with their writing skills. I have been scared and amazed with how good ChatGPT can write a letter. And the way it could work is, say, I'm the volunteer, I stay at my house, senior person calls me on the telephone and gives me the information that they want to put in this letter: who, what, when, where, and why. I'm at my computer, I put that into Chat GPT, and 3 seconds later, it spits me out a letter well, I did this. I did this something, then I handed it to my wife, the advanced placement English teacher, and she said, Phil, this is your writing is really good, really good. I just stop right there. Yes, I know where to put commas, but it would be that simple. The volunteer wouldn't even leave their home, and then they'd put it in the mail.
Well, that's a great idea. My goodness, when I write my column, if I get stuck, I'll just use the Chat GPT.
No, we will know. You cannot fake us.
We'll help
Good.
you, Scott. We use it a lot here at the office. We actually do, because it does help with different things and even social media posts. So it is something that could be a tool for those that quite aren't sure. It will even do it in formats that you request, whether it's a press release format, a letter format, strategic plan format, data format. It will do all of that. So if that's something we can always do a little how-to for your people, and then help them maybe do the next thing that they want to do on that.
Oh, well, thank you, Phil, Lisa. That might be another tool in my toolbox that I can use. Well, this a lot of information here, but basically it's just saying that, you know, the population for 18 and under is the population of 65 plus is going to surpass those that are under 18. And you can see some of the rural counties, particularly in the rural counties. And in Wasco County, we're getting awfully close, where the 65 plus is 20.1%, and the 18 and younger is 22.4%. And I suspect by 2030 there'll be more older adults than younger people. And I like to, figure out how, speaking of public health, how public health can be more involved in helping assisting older adults and their health, being how they're going to be a larger population than the 18 and younger. And the public health really got involved when it came to the COVID vaccines, because we worked closely with public health and Shelley to help those who do not have the internet connection or be able to get online to make their vaccine appointments. And that was a terrific partnership we had with public health, and that was great. So things are changing, and a lot of things that Karen Wilson is really talks about is how are we going to be prepared for that change in the future. Rural communities, isolation, loneliness, 29% experience depression and anxiety, 20% frequent mental distress, 39% low income. Income adults report depression and anxiety, and you can see 24% did not get needed mental health. And the challenge with a lot of this is that, older adults generally don't want to burden anyone, and they don't want to bother anyone. And so they may have depression and not tell you unless you ask. I've visited with one person just last week, and he talks about how he's dealing with depression. I've talked to another. Anyone who wants to be, is requesting services through Circles of Care, I make a, in-home visit assessment just to get to know the person a little bit. And in those, I've found several who have expressed being depressed because of their lack of contacts with other folks. I don't know if I've shared this story with you, but I was speaking with an old friend at the club in the locker room, and he was talking about, caring for his mom. How he sees her every day. And one time he visited her, and she just said, out of the blue, I am so lonely. And he said, how can you be lonely, Mom? I see you every day. He says, well, all my friends have passed away. And I just don't have those friends anymore. And so what we try to do with Circles of Care is at least create an opportunity for another friend. And that's another thing I would always recommend older adults, if they have lost a spouse or in that situation, go see Rob at the senior center. And that's the place where you will get a chance to meet friends and establish new friends. And that helps that psychological piece and mental piece. And then talk about non-driving, particularly in many rural counties, although in Wasco County, I feel we have a great transportation system. I know Sherman County has a terrific transportation system, but 50%, but as we know, 57% of older Oregonians live in rural settings, and 36% of those 75 plus households are without computers or cell phones. Of course, that's you can also say that 64% of folks households 75 plus do have computers and cell phones, and then 40% of rural women 75 plus live alone. You find a lot of women who live alone and by themselves. Transportation is one of the big issues. The Circles of Care is in the Dalles and also Hood River, and it's funded with Age Plus and Hood River Valley Adult Center. Amy Mallett there, they applied and received a grant from Providence Hospital when they decided to no longer continue their Volunteers in Action program. And so Hood River Valley Adult Center and Age Plus took it over in Hood River, and Amy was able to get I think either a grant or through the Hood River Providence Hospital to purchase an electric vehicle to provide rides. So there you have a picture of Brad next to the vehicle with one of the people they serve. And he takes people into Portland for their medical appointments. And that is one of the biggest demands, particularly in Hood River, for those rides into Portland for medical care. And when you get rides with a volunteer, it's often not just curb to curb, but it's door through door service where they will help you and make sure you get into your home safely. And it's a tremendous service. You can read what it says. And we have my wife, she's a community liaison. Rita's a community liaison in Hood River, and she has a volunteer who's willing to take people into Portland because she likes the long rides, because she gets to know the person that she's transporting. So that's pretty cool. And then it talks about the number of program people since 2022. Now, I know everyone's busy here, but if you know of anyone, the process is, I would love to say, is relatively simple, and on paper it's relatively simple, but it seems like any time you do anything, with technology, there's always some kind of hiccup. But there's an online application for Age Plus at ageplus.org, Circles of Care. You just Google that. And then you complete that application. Then there's some online training to make sure you're safe and the person you're serving is safe. Same with a background check. And then we have this volunteer management software that is supposed to work, is a fantastic program, but if you use it all the time, it's like many things. If you use it all the time, it's easy. But if you use it occasionally, it can be kind of difficult. But the thing is, I help, I'm always around to help folks to navigate that volunteer management software and to get people um, the application in and get their background checks completed. And I'm working with 3 people right now to finish that process. Here are the folks that are key. Yeah, as I mentioned, Amy, she's a go-getter in Hood River County. I mean, Hood River Adult Center. Brad is the driver who's been driving ever since the program has started. And he drives for Hood River and does not do dry rides in the Dalles. So we rely upon all volunteers and like Jody, like I mentioned before. And then myself and my lovely wife were the liaisons. Now, for the future, working with Circles of Care and seeing what I see, and let me make a point that what I see is much different what I saw at the senior center. And at the senior center, those folks were engaged. They came for lunch. They had those contacts. And I think Rob has doubled the number of programs that I had, going there. But so there's all kinds of opportunities to be engaged and be active and to volunteer at the center. But the folks that we work with are those who do not get out much or at all. And so there are quite a different needs for these folks. We a lot of times I ask somebody, would you like to volunteer? And they would tell me that they're already helping their neighbor or friend, or they have a brother-in-law just moved in with dementia and they're taking care of him, or they have a family member and they're spending time just taking care of that person with dementia. But it's made me aware, and I think it would be obvious, but that there's so many neighbors just helping neighbors. And that's what the Circles of Care is all about. And we're trying to fill that gap when that person doesn't have a neighbor who can help support them, and then we make a match and provide that help. But I thought, in my dream is having a neighbor helping neighbor month in May, just celebrating all the different folks who are helping their neighbor or a friend, and just celebrate all the good work that they do. And it's not headline stuff. It's just, that small day-to-day stuff. And the other thing I found is how many people have dementia that we help support. And so another initiative, and always looking for partners on this, is to create a dementia-friendly community. And the idea is to convene community leaders and members, and including those with dementia, because I know at least 2, I think 3, who I've asked would they be interested in this, and they said definitely, in order to better understand dementia and effects on our community. What I would love to see is an adult care for those with dementia, like just starting off with 4 hours a week to provide respite for their caregiver. And I've talked to Rob about that. It gets complicated putting in a program, but I think there's ways to do that. And then at the senior center, we had the 6-week getting to know dementia class, which was a powerful class, getting a better understanding of what dementia is and how those with dementia are still people. They still have value and they still can contribute. So those are just some of the future dreams I have from my experience working with Circles of Care. And so just thank you. And I'm going to get rid of this so I can see you guys.
How is Circle of Care funded?
Circles of Care right now is funded through the grant through Providence Hospital, Hood River Hospital in Hood River, and with help from Age Plus. And that's how it's funded. We do not take any donations. if we take any donations in the Dalles, we encourage them. Well, I take the money and drop it off at the senior center and give it to Rob as a donation to the senior center. In Hood River, the same thing. They get donations, it goes to the Hood River Valley Adult Center. So we have people who we transport particularly, and they want to give something. And so we don't deny that. We just, it's okay if you do, we'll give it to the senior center. So, and that's the challenge we're looking for. We're looking for a partner for Circles of Care in the Dalles, and to provide that service, because the funding from Providence is, I think we may be in the third year of that. Well, maybe, yeah, into the second year and starting the third year of the funding, and each year it decreases the funding from Providence.
One of the things I've noticed with the people who do these volunteer things is you talked about, the Neighbors Helping Neighbors month in May and things like that. People kind of want to stay under the radar when they're doing this kind of stuff, just like trying to find an Ageless Award recipient. Everyone who's doing these things, they're so humble and they really are trying to stay under the radar. So it's difficult to, support someone because you don't even know if they're helping. I see the people coming through to volunteer that Scott, he has the classes in our basement to encourage new volunteers. And I go, wow, that's pretty neat. And how many people he's getting and who they are. So just the humility of these people who like to help, and they're not obviously doing it for themselves. So again, it's hard to support the invisible superheroes as I see them.
Yeah, and that's exactly right, Rob. And I thought we won't point anyone. The idea isn't to point anyone out, but just a broad appreciation of all those invisible people that make our community strong. I asked some of the volunteers, why do you volunteer? And one of our most active volunteers, who's supporting a person who's blind, and it was written, he and Charlotte were written up in the Columbia Community Connections, is that it's more rewarding than a paycheck. It's just that connection. Another woman mentioned that it's personal. You get to know the person, and it's just not a one-time thing, and you really develop a relationship. In fact, the challenge for us sometimes is that they start as a volunteer and then they become friends. And then we need the data. We need the hours that you're volunteering to get the grants and everything. But it feels kind of, it doesn't feel right when you're actually trying to help somebody. And this person's your friend now. And I don't feel good reporting these hours, because I don't know, it's like taking advantage of the relationship. So we get a lot of people who actually develop a relationship with the person they've been assisting. And the other one last thing is that the volunteers we find, all of them are, 80%, 85% are 65 and older. And it's probably because of the younger people have more responsibilities. They may have kids and other things that work. And once again, the asset in our community are those older adults who are willing to have the time and can contribute to help other older adults.
Yeah, and my wife and I, we helped out for a couple of years. Actually, I was doing yard work for this one gal, and my wife was calling a couple of ladies every week. So it's a good program. The only reason we stopped is some health issues that we have to deal with, and now with babysitting kids, so I think we got a full-time job here. So anyway, but it's a great program, and we really enjoyed working with it.
I think we'd have a lot more volunteers if we could get rid of grandkids.
Ooh.
They take,
But the grandmas might have something to say about that.
Yeah, but the quote is, if I knew how much fun grandkids, I would I would have skipped the kids. I'd just gone to the grandkids. I would not have had kids. But yeah, I know. I don't think we'll ever have grandkids in my family. But anyway, so yeah.
Well, Scott, I was going to share something that really surprised me. I talked to a gentleman who's a senior last week, and he identified himself as being 94 years old, which he was quite sharp and quite well spoken on the phone. And that doesn't necessarily always go with every 94-year-old man. And he knew what he wanted. He caught me at 5 o'clock at night on the phone. And he said, well, young lady, I think I've caught you at the time of your hour to leave to go home. So I will not keep you any longer. Let me give you my email address. You give me your best approach on how to get natural gas to my home, because I'm looking to buy it and I'm looking to do $100,000 remodel in this home. And I just want to see what you can offer me. And I just thought to myself, this guy has got it together. And ironically, the other great part to the story is this gentleman also called. This was in the city of North Bonneville, and I was having troubles finding this location. So I called the city, and the gentleman I talked to at the city, he was like, I talked to the same guy, and he identified himself as the 94-year-old man who's doing all this work. And I thought it was quite charming that he was identifying his age on the phone, because that's very unusual. But on the flip side, I'm like, okay, when I'm 94, I want to be you, because he had energy, he had spunk, he had all of his cognitive skills. And then I'm thinking, and you're going to remodel a house? Wow. Okay, go for it.
Yeah. Yeah, it's well, you know that they say old age is what, 10 years older than you are. And that's what I found out, because when I started at the center at basically Rob's age, I thought 70 was pretty old. And then you get to 70 and think, oh, 80 is pretty old. Then you find all these folks who are 80, 85. Man, that's pretty old. And then you find a woman who comes in with a walker from across, she's at Cherry Heights Living. She comes in a walker, and if you're around the senior center, you'll see her walking with a walker all the time. And she said, well, I just want to share with you, tomorrow's my 100th birthday. I said, wow, I would never have known. But the perception of age is changing. You know, there's more folks like that, and not everyone is that fortunate to be in that place. And so, you know, a lot of things can happen. But yeah, it's pretty cool. You know, someone is 94. And I just interviewed a guy the other day, and he was, well, I'll stop my stories because we're almost running out of time. So thank you, Tanya. It is. And don't get into a perception of what old age looks like, because every person is different. And like a 94-year-old who's has email and fixing up his house, and there's other folks who may be 75 in a much different situation. But everyone's different. Don't have any stereotypes of older adults.
Well, Scott, thank you so much. And be sure, Scott, I want to make sure that you realize you can reach out to this group. If you need anything, you know, just ask. I know you're always looking for volunteers. We can help you try to put the word out. But it's just like, even just, you know, Phil mentioning the Chat GPT. That could be something that's fun, or something that they could do, or, you know, some seniors could be helping out youngers doing something, and they could be utilizing that for some of that, and editing and proofing and feeling needed. So, you know, I know we could always use help with just phones and greeting over here at the chamber. So if somebody really wants to be that, I want to meet people, I want to know it, I would love to put them at the front desk and tell stories about the Dalles. That's part of what we do. So we just need to engage our seniors.
And Lisa, I mean, the chambers had been always so supportive of the senior center with our elevator campaign. And when I became hired to work with Circles of Care, one of the first things I said is, we need to be members of the chamber. And so in the Dalles, the Circles of Care, we're members and all that, because I mean, it's such a community support. So,
Good. That's what I'm here for. We have an amazing community. We need to celebrate more often. So, again, Scott, thank you so much. And everybody, it is time to go. And I've got to jet up to a training. So you guys have a fantastic day. There is some gorgeous sunshine. Please go outside, take a deep breath, and know that we are moving and shaking in this community, and we are taking care of each other. And we have amazing passion in this community. So thank you all, because I know that you all sit on more than one board. I know that looking at this room. So thank you for all of your time, service, and energy for our community here. You guys take care and have an awesome day.
Bye-bye.